The state of Minnesota is still discussing whether or not it wants to unionize in-home child care providers through a vote. Now, that probably sounds fine and dandy on the outset, but let's really examine this. Unionizing in-home child care providers that run their own businesses privately out of their home. In other words, unionizing the bosses. Wouldn't this be like unionizing all Coca-Cola companies? Well, Coca-Cola, Pepsi, RC, etc. Or, well, I'll give you a better example of what this would be like unionizing, because the way the state of Minnesota wants to do it is they want any in-home child care provider, whether they're licensed or unlicensed, to vote if they receive children who are part of CCAP, which is the publicly subsidized daycare providing service that is paid for by tax dollars to families that cannot afford child care. It can be worth hundreds of dollars a month to these families. Any family that takes a child that is in that CCAP category, they would like them to vote on whether or not to be part of a union. But what would this union do? Nothing. That's exactly what the union would do. And 88% of in-home child care providers surveyed out of 1,700 have said the exact same thing. They don't want this. Yet our politicians in St. Paul are not listening to them at all. Why? Because it's a strictly party line vote. And this is one of these issues that the Democratic Party is turning over money to the unions in order to pay them back for their support. According to the Sauk Rapids Herald, in 2012, over $10 million from Ask Me Council 5, the union that's pushing unionization of in-home child care providers, gave that much money to the DFL party for re-elections in 2012. There's the 10 million reasons why the state DFL party is pushing this right now on in-home child care providers. And what would this mean actually? Well, it's going to mean increased rates for anybody that has child care providers here, or has child care daycare services here in the state of Minnesota. And the way this would work too is the union dues, in fact, might actually be paid by you and I as taxpayers. That's the way it's worked in other states like Michigan and New York. And our bill here is crafted in almost the exact same fashion. Now, what these CCAP children are, of course, as I mentioned, these children that get these government subsidies. Daycare providers take them in, and they get a certain amount the parents do paid for by the state. Well, the states are going to take a percentage of that they give to the child care providers and pay that to the unions as dues. Now, the unions say this is to give bargaining power and marketing power to these in-home child care providers. Now, they already have this right now through the Minnesota Child Care Association. They also have the ability to pool their resources like anybody else and buy health insurance, or buy health insurance individually through a company. There is nothing the union will do that will probably help them. In fact, the most staggering stat I've come across is in the United States, at one point, 13 states had child unionized in-home daycare providers. Of those 13 states, only 7 have them today. So if almost half of them have repealed in-home child care unionization, is it truly a good thing? I think this is nothing more than payback to the DFL party for support by the unions. And I think ultimately it would be bad for private business owners to be forced into becoming a union. After all, if you are, maybe a clinic or a hospital that accepts somebody on Medicaid or Medicare, does that mean you should now be unionized too? I don't see the difference between these two arguments.